The COVID-19 pandemic has changed the lifestyle of millions of people around the world. But one of the things that was most impacted was travel. Hello and welcome. This video is about how COVID-19 has affected travel. I hope you enjoy and learn something new. The outbreak first started in December 2020 in Wuhan, China. The World Health Organization first declared the outbreak a public health emergency of international concern on January 31, 2020, and a pandemic on March 11, 2020. In the summer of 2020, vacation numbers were down 15% already. Social distancing has made gathering a lot harder and regular day activities could not take place. So why do we social distance? Social distancing is a public health practice of preventing sick people from coming in close contact with an uninfected person, so that the likeliness of infection spreads lessens. Following social distancing rules includes canceling group events and closing communal places. With COVID-19, many public places require social distancing in order to lower the number of cases. If we could flatten the curve of cases, there would be less need for hospitalization and serious medical devices, so hospitals can have more space for other patients. The main idea of social distancing is distancing from other people, and a lot of the reasons for people to go on vacation is to see other people, or they could be going on vacation with people they don't live with. As I mentioned earlier, social distancing causes many group events to be canceled. So if someone normally would travel for an event, for example, sporting events, reunions, concerts, etc., they now don't have a reason to travel. Quarantine is similar to social distancing in that they are both public health practices. Practicing quarantining means you stay at home, away from others in your household. When you are in quarantine, it is also advised you check for symptoms of COVID-19, such as fever, cough, shortness of breath, etc. When do you quarantine? It is recommended you quarantine whenever you may have been exposed to someone who is infected, and you also should quarantine if you have returned from travels. People may be deciding not to travel in fear of having to quarantine when they get back. People could also be worried that they would have to quarantine on their trip if they got exposed or sick, which means they could cancel their plan and waste their money on transportation and a place to stay. Airports have many COVID regulations too. At some points in the pandemic, if you were going to fly internationally, you were required to take a COVID-19 test no more than 3 days before you travel into the United States. Some places even required no more than 1 day. You have to show your negative test results to the airline before you board the plane. If you had recently recovered from COVID, you must travel with documentation of your positive test results within 90 days before your flight, and a letter from a licensed health care provider or a public health official stating that you were cleared to travel. Sometimes during the pandemic, it was required to be fully vaccinated to board a plane to the U.S. Earlier this year and last year, you were required to wear a mask on planes. As of now, you don't have to wear one anymore. Most of the time, vacations are supposed to be stress-free, but thinking about all these regulations isn't the most stress-free, as if airports weren't crazy enough. During the pandemic, people have been traveling more by car instead of public transportation, such as bus, subway, or airplane. Most people avoided public transportation for the fear of getting sick or getting others sick. This results in many people not going on international trips or across the country trips due to long drives. Many people were also scared to go on cruise ships because they were another place you could be easily exposed to or get stuck on, because March 14, 2020, the CDC issued a no-sail order which calls for all cruise ships the U.S. has jurisdiction over to cease activity. The hotel business has also been affected by the pandemic. With not as many people traveling and being worried about getting COVID, not as many people have needed to stay at hotels. With some people not wanting to stay somewhere, many people have started taking more day trips during the pandemic. When people do have an overnight trip, they lean towards staying at an Airbnb or renting a house to avoid person-to-person contact. A COVID hotspot is an area of elevated disease occurrence or risk. It was not recommended to travel to hotspots during the pandemic. Some COVID hotspots, as defined by cases per 100,000 people, are Rhode Island, Alaska, and North Dakota. But some of these states with the highest number of total cases are New York, California, and Texas. These hotspots have big cities and tourist attractions that make them a hotspot. And the per 100,000 people hotspots are hotspots because they have less people, so more of the population has it in the state. These hotspots changed travel patterns during the pandemic. A lot of people had trouble keeping up with their usual income during the pandemic. COVID meant that many businesses couldn't operate their normal way and many employees couldn't physically go to work. Lots of people had to get laid off because businesses had to cut costs and business owners were losing their businesses due to lower income. Some of the hardest hit businesses are restaurants, theaters, and construction companies. It can be hard to find the time to get away when you have to work extra hard to keep your business afloat. So some people may not be taking time off from work. This can also cause people to not have enough savings to feel comfortable going on vacation. If you're scared your trip might get canceled or postponed, you can get help from some insurances to cover prepaid trip expenses. Insurance could also help with medical costs if you get COVID on your trip. When you travel during the pandemic, it will most likely be less crowded because places have less capacity and social distancing rules, so that is a nice bonus. One thing that became really big during the pandemic is working from home. A lot of people couldn't go to work, so they would work and do school online from the comfort and safety of their homes. This makes it a lot easier to travel because you could be on the beach or in your car doing work, you just need your device. This definitely changes travel patterns because now people can go on vacation during the middle of the week and not have to take off work. Rental cars. Many travelers rent a car when they arrive at their destination. As travel levels plummeted in 2020, many rental car companies sold large portions of their fleets in order to stay afloat. But travel rebounded in 2021 quicker than car rental companies could expand their fleets. Due to supply chain challenges, global auto manufacturing is down, which means dealer lots are sparse. For 2022, consider public transportation, booking your car early, or rental car companies' loyalty programs. Tourist attractions will attempt to balance capacity with staffing shortages, and attractions will have more time tickets. It will be more important than ever to buy tickets ahead of time in 2020 as you are traveling. Many locations you travel to will do more health and security checks to see where you're coming from and to keep an eye out for outbreaks of a virus that could potentially become a pandemic. More places and people will be way more cautious and sanitary when traveling. If you are planning on returning to the road or flying, expect things to be very different in 2022 and for years to come. Thank you so much for watching my video on how COVID has affected travel. I hope this video was helpful to you, and safe travels.